welcome back to my channel. This is episode 2 and I'll be talking to you about my first ever clinical placement, which was a diabetic ward for the trust that I'm currently working for. I'll be telling you about my feelings, how I felt, excited, nervous, absolutely clueless, didn't know what to expect. I'll be giving you my impressions of the ward, I'll be giving you what surprised me, what made me feel really nervous. I'll be telling you about my experiences, the good and the bad, unfiltered, and I will share some reflective points that I think would help you guys going into your first clinical placement for those first year students. So my first clinical experience was a 27-bed diabetic ward. Now I had no experience previously with diabetes. As I said, my background was working in A&E as a healthcare assistant for a couple of years prior to starting the degree, and I just had no idea what I was going to be walking into. And obviously, this was my first ward environment as well, so I was extremely nervous, clueless to how the routine worked, and I knew that I was going to come across some abbreviations and some things that I had absolutely no idea what to deal with. And I think you put a lot of pressure on yourself as a first year student because you want to impress and you want to make an impression, and you don't want to come across like you're lazy, you don't want to come across like you don't know what you're doing. So you put a lot of pressure on yourself. And I remember thinking, why don't I know this? I should know this. Um, Especially after my first week there, I was extremely self-critical. And then you kind of fall into a routine where you realise, actually, I'm a first year student. I'm not supposed to know this. And some nurses don't know this at all. So just be really patient with yourself and try to put too much pressure on yourself. That's a little bit of advice I can give you straight off the bat. So I remember my first day really, really well. Those double doors opened to a big long corridor, and there were 4 bays of 6, and there were 4 side rooms. Now the side rooms were used for infectious patients that had things like C. diff, CPE, norovirus, flu and COVID, and other kind of communicable diseases that can be passed on to vulnerable patients. So the way it worked in the diabetic ward is you had 2 bays that were male, and then you had 2 bays that were predominantly female only, and the side rooms were obviously for single-use patients anyway. Um, so I went in, sat down, introduced myself to all the nurses and the healthcares, and they were all really lovely and introduced themselves to me. And the one thing that I loved about this ward is they always called me by my name. I was never the student, which you will get a lot sometimes. So you just need to be very, very, um, you know, polite and explain that, my name is this. Please, can you refer to me as X, Y, and Z? Um, Sat down, had handover. They gave me a handover sheet, told me that I'd be working with the male patients in bays 1, 2, and then side rooms 5 and 6. And I would be responsible for working with the healthcares for the first 2 weeks, because the way that it worked at my university is your first experience in clinical placement will be 2 weeks, and then you'll have spoke placements in between, and then you'll end for your final tripartite back at your hub, where you'll spend 6 weeks in total getting signed off to progress into second year. So for those first 2 weeks, I did predominantly work with the healthcare assistants, and I think it's really important to stress that some people get very frustrated when they work with the healthcare assistants, but it's really important to understand that healthcare assistants now are extremely critical in what they do. They're very hands-on with patients. They do a lot of clinical things that the nurses used to do, which now the nurses don't do, because a lot of the role of the nurse now is documentation, interventions, MDTs, and then holistic patient care. So the healthcares kind of have that really important role with that hands-on experience with the patient, such as personal hygiene, nutrition, input and output charts, toileting, bowel opening, passing urine, catheter care, skin integrity. They do a lot of things that as nurses you may not get time to do all the time. But I think now being a second year nurse, the most important thing for me is skin integrity. Like, you need to really, really, really check that, even if you know you haven't seen the patient. It's really important that you get the healthcare assistants to tell you about skin integrity, and that you double check yourself. It's really important. So I worked with the healthcares, and I learned a lot about skin integrity. Like I've said, pressure care, pressure relieving mattresses, looking at moisture lesions, DTIs, and moisture lesions. I learned about catheter care really quickly, because a lot of our patients had catheters. I learned about input and output charts and the importance of accurately recording what goes in and out. Now, the way that this trust that I work for, the way that they monitor input and output for patients is by having the traffic light system on the jugs that are placed on the bedside tables. So red means it's their first jug, amber second jug, green is third jug. We would always aim as a trust to have green on all of the patients by the afternoon. regardless to the ones that are on fluid restrictions, they would stay on blue. So fluid restriction is for those that are either nil by mouth or have renal issues that require them to be on restricted fluid intake, or have issues with heart failure and are very edematous. And I'm actually really grateful for my experience with the healthcares, because they were fantastic and they were so knowledgeable. They just knew everything, and they were willing to teach. That was the one thing that I'm very lucky for at this ward. They were very willing to teach. It didn't matter whether or not they were healthcares, nurses, doctors, whatever. They loved students, and they would grab you and say, "Oh, I'm doing this today. Do you want to come and have a look, and do you want to observe?" So for me, this first placement, looking at the entire 6 weeks I was there, by the end of that, I was doing something that a second, third year student would do in regards to managing patients. So it was really, really good for me. Now, I thought with this being a 27-bed ward that it was going to be quite calm, quite relaxed, and I could kind of ease myself in. That was not the case at all. I hit the floor day one, and it was just straight into patient care. And I was looking after 2 bays of 6. So it was, you get patients that are self-caring. You kind of prompt them to get up to bed. When they want to have a shower, you get everything ready for them. Ask about their skin, how they slept, things that you can tell the nurse to document. And then for those double ups, I'd always work with the healthcares, and I would kind of say, look, let me work with you so I can do the double ups, so I can get used to looking at skin integrity and other things that you do when you're working with patients with assistance of two. I learned loads. I learned how to document. I learned how to look for things, how to kind of my nursing decision making, things like that. Working with the healthcares was fantastic. And once you get involved with the healthcares and they see that you're willing to work, life can become a little bit easier for you as a student nurse, because you can then go off with the nurses further down the line and do more nursey things and learning how that routine works. Another thing I wanted to say as well is, even with this being quite a small 27-bed ward, you'd get a lot of cohorted patients. So it meant that you would see that side of things, where you had patients with acute delirium, with mental health problems, or that were just generally very unwell and behavioural. So it's really important that you don't shy away from those opportunities. And as students, you shouldn't really be cohorting for long periods of time. As you know, when you're practicing, you have to be supervised, and when you're cohorting, you're not supervised. So you need to really weigh up the options of what's safe and what's not safe. You can ideally cohort while you're covering a break, but you shouldn't be cohorting for long periods of times. Now, I don't know if that is the case for every university, but for my university, that is what we are told and what we do. First things, I think, like I've discussed about the things that I saw on the first day, and that continued on through my second weeks. And I think what stood out to me the most was how diverse diabetes care is. It isn't just, you're not just caring for someone with diabetes, they've got so many comorbidities, such as heart failure, renal failure. A lot of them I found had like necrotic toes, or had wounds, or had amputations. There's just such a diverse set of comorbidities that you have to manage alongside the diabetes, which just again affirmed to me how critical it is that you get good diabetic care. And I think what I found with patients, regardless of age, if you manage your diabetes well, your comorbidities were quite good. And then for those that had poor hemoglobin control, or just didn't have any control at all, you'd find would have a lot of other health issues that were going on, and especially with leg ulcers for poorly so those that have hyperglycemic episodes, which is high blood glucose levels quite frequently or are constantly within in that range, I found a lot of leg ulcers and amputations from that. So that's kind of my first impressions of the ward. I'll lean on now to what surprised me. So things that surprise me, and I think the first thing that I can talk about is the responsibility that students are trusted with. Like my first 2 weeks, you're kind of straight in there with patient care, and you're making some decisions on the care of that patient, and that's a lot of responsibility. And that was kind of honed into me quite quickly, how responsible you are for that patient. Another thing that really kind of hit home to me is patients that come into the acute setting, specifically, how many comorbidities they have. So, and that's not just in diabetes, that's just in general. Like someone would come in and it wouldn't just be one thing that's causing an issue, they'd have multiple comorbidities. And you'll hear this comment a lot about polypharmacy, which is where patients are on more than 6 medications at a time. And you just think that's incredible. Like, it's just crazy. I think the emotional impact of caring for people with chronic conditions can be quite wearing sometimes. And, if you're like me and you take things to heart a little bit too much, you can kind of go home thinking, well, have I done enough for that patient? Have I done enough in regards to caring for that patient? And have I done what I should have done? it can be quite wearing and taxing sometimes. And this course isn't for the faint-hearted. It's very busy. You barely get any time off, and it's very, very difficult to kind of unwind sometimes. And for me, first year was just an absolute out of the bag. It was everything was new, everything was different, and then I just felt like I learned so much so quickly in a short space of time. While I was at this placement, I learned lots and lots of skills. And that wasn't just, taking blood sugar levels, administering insulin, which was really good for me because you got to kind of shadow the care staff, watch how they did it, and then they would let you do it. Insulins nowadays are normally done by pre-filled pens, and then you just kind of crank them up to the units that you would give the patient. Um, and it's really good if you can get on to practice a medication round, because what you can do is get used to how everything works. You can get used to what you're looking for in a Mars chart or a prescription, and you can, um, the the routes of administration, and just get real hands-on experience with medication, because it's really important that you practice, because you'll have that exam at your third year, which is a 100% pass rate. So you need to really understand your um, your multiplications, your mathematical solutions for medication, and really understand what they mean and how to do them properly. I did a lot of observating um, with um, diabetic foot care with the podiatrists that would come round. So podiatry, it's a really funny thing when you're doing wound care, because podiatry will do anything below the ankle, and it's normally health, as in nursing, above the ankle. But you'll kind of what you'll find is you'll end up doing pretty much most of it anyway. So I got to see a lot of foot checks, wound care, which is really good for me. And I'll cover later on down the line my second year, because my second year hub was community. So having had this diabetic experience worked really well for me in community. And communicating with patients and managing their conditions was really good for me to see as a first year student, because I'm quite an extroverted person, so talking to people was really easy and really comes quite naturally for me. Um, and I got a lot of good feedback from patients about my manner and my mannerisms, and how I spoke to them, how I made them feel, how I dealt with things um, like that. And charting and documenting. So I got to understand how to initiate care plans specific for the patient's needs, how to document using your ADLs, and how to document accurately, factually, and get rid of that jargon. It really helped me do that and managing patients. I got to learn a lot of new skills, and some of the biggest lessons that I'll take away was understand that diabetes is more than just sugar control. How type 1 diabetes is an autoimmune response, how type 2 diabetes can be kind of the risk can be mitigated through health promotion, and people being compliant or um, concordant to healthier diets, eating less transversal fats and sugars, and just trying to eat healthier, exercise a bit more. And then another really good lesson that I learned was how the nurse's role advocates and educates their patients. Very big on health promotion. I got to see how teamwork can make a difference on a busy shift, and how that by helping your colleagues with their workload, or by offering a bit of experience or advice, can really help on busy shifts. I got to see the importance of compassion in chronic care. So people that are coming to the end of life, or that are on palliative care. It's really important as well that you understand the difference between palliative and end of life. Palliative can be chronic long-term pain management, whereas end of life is that where people are kind of coming to the end of their natural life. And how a bit of compassion can really help not only the patient but the family members. And it's really important that palliative care or end of life is that you give a patient um, a really good experience when they're dying. And I mean, just be compassionate and give them that um, kind of control back that they want. And I found it really difficult for my first end of life patient. I'd seen death before, and I'd seen people that had passed away, but having been involved in the process from start to finish, you kind of develop emotions. And it was really good for me reflecting on that, how important it is for me as well to be able to decompress after something like that. Some of the challenges and awkward moments I experienced on this ward, being my first placement, was probably number one would be that feeling of overwhelmedness, and completely out of my depth and my comfort zone, which was good for me to learn from and kind of get better at what I was doing. Um, and I think, having reflected on it, moments where you make mistakes or have had that learning moment, I think I'm very honest about my mistakes that I make. So I put my hand up and say, yes, I did this wrong. How can I improve? And then I like constructive feedback. On this ward, they were very good at giving constructive feedback and letting you know that you're not quite up to standard here, so we'll continue to supervise and monitor and offer you extra training until you get it. And then I had this kind of learning moment when I was with a second year student that was kind of took me with them and kind of was giving me a bit of advice and telling me what to do in regards to kind of finishing my first year and looking forward to going to my second year. Is they said, every opportunity you can get is a learning opportunity. Take from that what you will, and that will put you in good stead for the continuation of your training into second and third year. And that's kind of been that learning moment that I've taken from that student. I've had days where I had a really bad day, or I did something silly and I just felt stupid. And then you just have to bounce back from that, kind of reflect on it, put it in the back of your mind, get rid of it, move on, go forward into your next day, and just take those learning opportunities as you go. So my placement assessor, I never actually met in my first year, and you'll probably find this a lot of staff turnover, a lot of staff sickness, so you might not actually get to work with your assessor. But I did work with placement supervisors all the time, every day, and they were wonderful. They were really attentive, really willing to learn, would take me up to opportunities and get me to see that. And as a first year, they were taking me into observing opportunities that you wouldn't normally see as second or third year, and I was really grateful for that. So I got to get involved in the MDT meetings, in the morning and the afternoon meetings on the ward, looking at my patients and what discharge kind of was coming in, any change in medication, any change in the care plans, anything that needed to be kind of done on the nursing side of things. And you get used to MDT approach, working with other professionals such as the doctors, the pharmacy, and the social workers. And I was really, really grateful for that. But they were just so attentive. By the end of my first year, I felt really confident in dealing with an acute ward. Having been through my other previous placements that was spoke and then finishing off, I just felt like the mentorship that I had from that first year, from the staff on the ward, was just great, and it was really fundamental to my learning. And I'm still, as a second year now, going into third year in September, I still think about this ward, and it's actually somewhere where I would consider to work. That they just made me feel really welcome, really comfortable, and I could ask questions and they're willing to teach and learn. So if you can get that, that's fantastic. And don't be afraid to speak up and ask if you want learning opportunities to going forward to enhance your learning. So some advice that I can give to potentially the first years that are already in their placement, or people that are going into their first year clinical placements, is that you need to really be open and ask questions. No one expects you as first years to know anything. I think when you walk on a ward, they'll ask you, what kind of experience do you have? And they will always send you with the health cares to get that fundamental training. And then once they're happy that you've got the basics, they'll take you on to learn more intermediate and advanced skills. And you'll always hear there's no such thing as a stupid question. And if you get like a ward or a clinical placement that is willing to teach students, there is no such thing as a silly question. You will get a bad experience somewhere, but that's for you to deal with personally and just kind of move forward and learn from those experiences. Another really good tip that I was given was to keep a very small notebook, um, or use notes on your phone. Your phone in a non-clinical environment, so if you're on your break and you want to write something down, you can note it or do a voice note, but I always kept a really small A6 notebook with me, and it just helped me jot down any little tips that I had, and like acronyms, or if I came across a procedure that I hadn't seen before, or like wound care or diabetes, I'd write it down in my little book, and then I'd take it home, rewrite it into another notebook so it was legible and made sense. And I think it's really important, and I've learned this as a second year, that you need to take time to reflect after busy shifts or even traumatic shifts. If you get like a met call, or if you have like an emergency CPR, or anything that's kind of traumatic, take that time to reflect and lean on your colleagues, because it's really important that you go home and you don't stew on things, because you need to be well emotionally, mentally, and physically to do the job that you're planning on doing. And then, you can reflect on things that you think that went well, or things that didn't go so well, and then how you want to go forward and improve. And don't be afraid of constructive criticism, because constructive criticism is something that teaches you how to learn, how to move forward, and how to better yourself. And as long as it's constructive, you'll learn from it. And I really do want to push that little bit of advice out there is don't be disheartened when you get constructive feedback, because your first years, you're not going to know everything, and you need that feedback to go forward, learn, and improve. And you know, as nurses, when you qualify, you're going to be continually improving and reflecting and getting constructive feedback just to make you better practitioners. It's something that you shouldn't be afraid to get, and something that you shouldn't be afraid to utilize moving forward. And I think the biggest thing that I can give you, like I said previously, is that you should always remember that you're continuously learning, and that's okay, because you're going to be continually learning from year one, year two, year three, and into your professional career. And you shouldn't put too much pressure on yourself if you don't know something. You've identified an area that you need to go and maybe research or look into a bit more. Those would be my little bit of friendly advices for you guys that are going into first year. And I think on personal reflection, um, this first year placement that I had in the diabetic ward helped shape the way that I viewed nursing, because then I realised that nursing isn't just being hands-on with patients, there's also a lot of documentation and legal aspects to nursing. So that opened my eyes and broadened my horizons quite quickly. And a moment that made me feel proud is when we had an end-of-life patient that had written a letter thanking me for my compassion, and then the family brought in had gone home once the patient had passed, and about a week later came back in with a bouquet of flowers and some chocolates for me. And I thought that was really a moment where I know actually I made a difference, and I'm happy and proud that I did that. And I still see some patients from that first year placement in diabetes ward, especially out in the community in my second year, who recognised me from first year, and were like, oh, you know, and they said how wonderful I was, and that was quite nice to get a bit of feedback, so I know that I did something right. So that's probably one of my proudest moments so far. And will I work on a diabetic ward again, having reflected? Absolutely. I learned loads. Um, I'll probably be looking at maybe like a specializing in that area, if that was something that I wanted to do. But as a foundational place, I thought it was really good for my learning and development, and I enjoyed the ward. I never went home feeling bored or hadn't learned anything. I was constantly kind of like, oh, I just want to go back and see what else I can learn, what else I can do. So for me, on my personal reflections, I learned a lot from that ward, and I was really grateful that I had that opportunity, especially as a first year hub. Really lucky compared to some of my other colleagues that I've spoken to. So I was very lucky, and I really did enjoy my first placement. So I hope that you've enjoyed this video, and I hope that I've been able to give you some really good tips and a really good, open, honest experience of my first year with my first clinical placement on the diabetes ward. And I just want to thank you for taking the time to watch the video, and I hope this video has helped. And I'd invite you to pop in the comments some of your own personal first year experiences of your first wards, because I really like to get some interaction with the guys that are watching the video. And I'd like to just hear your experiences and see if they were similar to mine or if they were slightly different, or if you've got any kind of personal reflective points that you think could help other students, please pop them in the comments and I'll try to engage with you guys as much as possible. So my next video, we're going to be taking a deeper dive into my placement routines, dealing with feedback and some burnout prevention that I felt during my spoke placements. Stay tuned, and I look forward to seeing you guys in the next video.